Hello everyone, welcome back to the channel. Your go-to space for real, relatable and useful OET speaking preparation. Now imagine this. A patient is rushed into the emergency department, short of breath, panicked, wheezing, and yes you, are the doctor standing right there. What you say in those 2 minutes can make or break your OET speaking score. Today, we are dividing into real emergency room scenarios for doctors, but even if you're a nurse, physio, or any other healthcare professional, don't go anywhere. These strategies apply to everyone. So let's start with a quick checklist of what makes a winning OET role play. Here's your golden checklist. The first one is warm introduction. Start with a polite greeting, state your role, and confirm the patient's identity. Set a calm tone. Always remember that. Okay. And the second one is understanding the scenario. So you have to identify the problem and then respond to their emotions. Don't jump into robot mode. Try to ask open ended questions to gather relevant information first. Then explain treatment clearly and calmly. So you have to treat each bullet like a mini goal. Blend them naturally into your conversation. Check understanding, don't lecture. This is also pretty important, right? And use simple, friendly language, no jargon. Don't use so much of technical words. Speak like you would to a non medical person. So instead of saying a word hypertension, try to say high blood pressure and encourage and reassure. So you can pause and ask things like, does that make sense? Or would you like me to explain that part again? Encourage and reassure the patient in an appropriate way. Then finally, end with next steps or follow up advice. So summarize what you have said and thank them and then clearly explain what are your next steps. Let's see an example. So this is a role play card and it's for the doctors. Setting is an emergency department. Patient, a 28-year-old with an acute asthma attack, now stabilizing after a nebulizer treatment. Okay, and the task here is reassure the patient about their current condition, explain what treatment was given, highlight the importance of regular use of preventer inhalers, educate on recognizing early warning signs, advise what to do during future attacks, encourage follow up with GP. Now, these are the tasks given here, and this is your role play card. Remember the strategies or the checklist, whatever we have discussed, try to incorporate those with this role play card and try to be ready with your speaking test. Okay, I'm going to show you two examples. One is not so good role play, and one is the best role play, how it should be really in order to get you high scores. Okay, so let me show you the not so good one. Hello, you had an asthma attack. We gave you nebulizer. You are okay now, but you should take your inhalers more. If you feel bad again, use the blue one. Also avoid dust and smoke. You should see your GP. That's it. So this one is very boring. So much of rushing there and it's very flat. So what went wrong here? The robotic tone. No comfort, no warmth, no structure also. Advice just thrown around like a confetti. And no engagement, doesn't even ask how the patient feels. No kind of reassuring. When you ask the patient only, then you will be able to reassure the patient, right? When you give chance for the patient to talk, there is no opportunity for the patient to talk. And weak words like feel bad. If you see here, we have used the word feel bad, which is very vague and unclear. And no empathy at all, which is not at all acceptable. Patient had a traumatic experience, but it's treated like an afterthought. So this is the kind of role play that sinks your score, especially in the clinical communication and appropriateness of language criteria. Now, I'm going to show you the best version of the role play. Let's get started. Hi there, I'm Dr. Amin. You have had quite a scare today, haven't you? I can see you are still a little shaken. Totally understandable. But what I want to reassure you, you are safe now. The nebulizer treatment has helped open up your airways and your oxygen levels are improving nicely. You're breathing much better than when you arrived. How are you feeling now? And the patient is telling I feel a bit better, still a little tight in the chest though. That's expected, and we will continue to monitor you for a while longer. Now, I noticed you haven't been using your preventer inhaler regularly. Is that right? Yeah, I only take it when I feel something coming on. That's actually a common misunderstanding. The preventer inhaler isn't just for when you feel unwell, it's meant to be used every day, even when you're feeling fine. Think of it as building protection inside your lungs to stop attacks before they even start. Oh, I didn't know that. No worries. That's what we are here for. I also want you to be aware of early warning signs like waking up at night, coughing, or using your blue inhaler more than twice a week. Those are red flags. If you spot them early, you can act quickly. Okay, so what should I do next time if I feel breathless? Great question. Always carry your reliever inhaler with you. That's the blue one, and use it immediately. If symptoms don't settle within 10 minutes or they come back quickly, don't wait. Come straight to the hospital or call emergency services. Better safe than sorry. Got it? Lastly, I'll be giving you a written asthma action plan, and I strongly recommend booking an appointment with your GP in the next few days to review your treatment and follow up. You have done the right thing by coming in today. Let's make sure you stay well moving forward. Now, let's decode what made this high scoring response. The first one is tone. The tone is very reassuring, warm, and professional. And the second one is about the structure. It's very clear, right? Clear beginning by reassuring, and then middle, you're talking about the treatment, education, and then about the follow up. And empathy. This one acknowledges emotions, and we are using analogies here, protection inside your lungs, right? And also here we are checking for understanding. We are giving patient some room to speak, response to their concerns, and we are also inviting question, right? And we are using the right language, no technical jargon. It's very clear, simple, and patient friendly. So this means all the OET speaking criteria are in place, like clinical communication, appropriateness of language, relationship building, organization of information, fluency, and intelligibility. Okay, so there you have it. Two versions we have seen. One is not so good example, and we have also seen the reason as why. And one is the best. It's a fantastic thing, incorporating all the criteria of OET speaking. And now you know the difference, right? So want to stand out in your OET speaking? Practice real scenarios like this. Record yourself and listen. Focus on connection, not perfection. That's all for today's video. Kindly like, share, and subscribe for more OET strategies. See you in the next video. Bye bye.